Hi, I'm Lauren and I'm a Together Type 1 Young Leader. At this year's DUK PC in Glasgow, I got the chance to speak with Professor Shoumo, who's leading a Type 1 Diabetes Grand Challenge research project that takes inspiration from tick saliva to develop a defence mechanism for beta cells transplanted into people with Type 1 diabetes. Curious to know what we chatted about? Enjoy this episode of the Grand Challenge Chat. And I'm just interested in kind of what was, I don't know if the word's inspiration, but what kind of made you study that and go into that? Like, is it someone in your family that's diabetic, or is it just like a passion for it?
So I became a doctor, and I've really enjoyed being a doctor. I'm a cardiologist.
Okay.
I've not actually been involved with diabetes except to see the complications of patients who have diabetes. But in the middle of my career, I decided really that I wanted to do things like drug development and so on. So I also became what's called a molecular biologist.
Okay.
And in cardiology, the biggest problem is things like heart attack and so on, which, although you might think it's just cholesterol, it isn't. It's about inflammation as well.
Yeah.
So the heart attack is caused by the furring up of the heart arteries, plaque, and this gets inflamed. And when it gets inflamed, it breaks up into little bits, and you get a stroke, or you get a heart attack, and so on. And it's a complication, of course, of diabetes.
Yeah.
Now, we started working on things that could block inflammation, and all my research has been funded by the British Heart Foundation. Okay. And I realized that people have been trying to block inflammation by targeting the ability of the entire body to respond to inflammation. And we wanted to focus the inflammation to just where it was active rather than all over the body. And we looked at ticks.
Yes.
Yeah. So no diabetes yet, you know.
No,
just ticks.
Just ticks.
So when you probably know ticks, right?
Yeah.
So when the tick bites you, it's putting out there is no inflammation. So when the mosquito bites you, immediately get a bump in your skin.
Yeah.
Yep. When the tick bites you, nothing of the sort happens. You don't even know that the tick's bitten you.
Mm.
Yep. That's because it's injecting stuff under the skin to stop inflammation.
Okay.
Yep. And so what was this stuff? You know? So about 10 years ago, we started looking at what this stuff was.
Yeah.
And it turns out that this stuff is something that binds what are called chemokines. Chemokines are what drive inflammation.
Yeah.
Now, chemokines have been known about for the last 30, 40 years, but no one's been able to make a drug against them.
Yeah.
And yet, ticks, over 200 million years of evolution,
Yeah, I was going to say.
have done it, have worked it. So we started going after the tick, and we developed what are called small bits of the tick protein that could be turned into treatments.
Okay.
And essentially, the 1 week just before a couple of Christmases ago, the director of my institute, John Todd, who's a very eminent immunologist involved in diabetes, popped his head around my office and said, Shoumo, there's this grand challenge stuff happening. Your stuff could work for it. Put an application in. And so I did. So that's how I got into this field.
Okay.
So it wasn't actually my thinking about it very much.
Yeah.
But it was actually someone else who could see the potential in our work and brought us together. And actually, it was only because the funding was available from Steve Morgan and Sally Morgan that we were able to do this.
Yeah.
Because normally, no one would fund something as outlandish as a tick-based.
You guys say that it raises a couple of eyebrows, so I could appreciate.
You can wonder what. This sounds too left field, shall we say?
Yeah.
Yeah, so here we are. So we applying what we've developed for heart disease to what actually happens in eyelids.
Yeah.
It could work there too. It's the same process.
Yeah.
The same chemokines happen, and as you probably know, in the treatment of type 1 diabetes involves drugs that block T cells.
Yeah.
Now, they're great, but they're blocking T cells all over the body, and that's not good. So it increases risk of infections, cancer, and so on. And so we think that our method could be used to target the islets themselves.
Yeah. Just one particular. And with your studies, did you say, that it can be used for the what you're using for the diabetes, but did you say also for the heart and things like that? So it's actually using it on just specific areas that is needed.
That's correct. And the way we're plan to target this is to use something called a nanobody, which comes from a camel.
Yeah.
So it's a tiny antibody.
Yep.
But you can make these antibodies go only to the site where there is inflammation, not all over the body. So you can take your drug and take it exactly where there is inflammation.
That's crazy. That's really, really cool. And so whereabouts are you now within your study? Are you kind of at the start of it?
We're very much at the start.
Yeah. So I just wanted to ask, because obviously some people might be like, actually, we're quite far ahead in what we're planning. But obviously I appreciate it's a very, very long process.
This
trial and error, isn't it? And trying to figure out what.
Absolutely. So for instance, each drug that you might think has actually been started in its development over 40 years before.
Yeah. And usually for something completely different.
And sometimes for something completely different.
Yeah. It's like how, I can't remember what it was, but there's one of the drugs they used for like antidepressants, but it was for long-term pain relief as well. I can't remember what it's called, but things like that. It's quite cool actually. It's very, very smart. And when I was reading your work, I was reading it to my partner as well, and he was very, very interested. So one of the other things I wanted to know is, do you do your studies within Oxford or is it elsewhere?
It's all within Oxford.
Okay.
I have a laboratory in Oxford. I have fellows and students who actually do all the work.
Yeah. Oh. Would you be open to with Together Type 1 we cover the entirety of the UK and part of Ireland, Northern Ireland. Would you be open to maybe one day, if possible, having maybe myself and another young leader come and actually have a look ourselves as well?
We'd be delighted.
Because that'd be really exciting. Because obviously hearing from you about what you're doing is amazing, and obviously I can picture what is going on in my head, and then actually seeing it, I think that'd be really, really
absolutely
brilliant. I'll speak to John when I get back in. Lovely.
So, Lauren, tell me, you told me that you've been were diagnosed with diabetes from the age of 11?
Yes, yeah.
What would you like to see in a diabetes treatment?
I think, for me, like the whole treatment of diabetes is so progressive when it comes to just technology, medication, and all of that. And I think it's just something. I know it sounds like a really kind of simple answer, but it's just something that can help us, something that can make our lives just that little bit easier. Because diabetes is such a hard thing to deal with. Like, you explain to people and people can understand and they can, they can empathise with you, but actually, as a diabetic, speaking to some people who aren't diabetic, it's really hard to get the point across that it is so exhausting, and having just some kind of treatment or something that can help us live our life like a normal life or semi-normal. No one has a normal life these days, but live just a normal life where we can still do things and still have a happy kind of day. But yeah, it's just something that can kind of help us and make us feel a little bit more. As a diabetic as well, people look at you when you're injecting in public, when they're looking at you when you're doing these things, and you almost feel embarrassed and you feel awkward because you're like, although this is something that keeps me alive, you feel as if you're disturbing everyone else's peace by doing something that keeps you alive. I've had people ask me, why am I taking drugs? And I'm like, I'm just taking insulin. Like, this keeps me going. So, it's just having something that can help us and, help because diabetes is going to be around for a very long time. Whether there's a cure or not, there's a lot of people with diabetes. So it's just finding something that can help us and support us with our journeys as we continue with our lives, really. So yeah.
And ideally, what would you like? Would you like complete, let's say, freedom from insulin is what I'm probably guessing.
Yeah.
Never having to take an insulin jab again.
Yeah.
Never having to monitor your blood glucose again.
Yeah. Honestly, it's that. It's
that. Yeah.
You know, no one with diabetes wishes they had it. You know, no one wanted to have it. We didn't ask for it. We just got it, and I think that's really hard for a lot of us to kind of deal with. And you know, we have the days where we sit there and go, do you know what? I don't want to deal with it. I don't, and we ignore it. So if there was ever a point where we could actually go, rather than ignoring it, we don't have to do these things, that would be like the pinpoint of diabetes, you know, like that would be what everyone's dream is, to not have it, because it is quite difficult, especially again in social situations, all the appointments you have to keep up with. Not only are you diabetic, but diabetes comes with, as I said, a lot of other health problems, trying to keep on top of all of that, it's a lot. So just basically saying, no, I don't have to inject, I don't have to monitor all the time, that would be like the main thing, really.
One of the things that we are trying to develop when we do our treatment approaches is to develop something that it will need to be given by an injection, but you know, maybe a once a month injection perhaps. That would block.
I feel as if though, like once a month compared to, you know, 4 times a day, even with pumps it's every 3 days, you know, lowering the amount of times you have to inject yourself with a needle, reducing all of that is so much better. You know, everyone gets so excited over the technology that we have because it's injecting less and less. You know, you're not finger pricking 4 times a day. Like, that's exciting for us. So even if it's just down to once a month, you know, I think a lot of people would actually be jumping at the chance for that, especially people who don't like needles, because just because we're diabetic doesn't mean to say we like needles. When I first became diabetic, I was so needophobic, it took me about 45 minutes just to do my normal injection, because I just couldn't do it. I couldn't bring myself to do it. And my mum had to support me, and, you know, especially for young children, I feel like it's easier for them to cope with 1 injection a month rather than multiple a day. So, yeah, I think if you can't reduce the injecting at all, even just... can't get rid of it completely, even just reducing it to a lower number than we already do would be, again, something that's really, really helpful.